Wherever you came from, whether you're a Dyersburg or Dyer County person, or whether you came from Nashville, or no matter where you came from, there's several reasons why you might be here today. It might be a health reason, it might be a commerce reason, it might be just a strictly selfish reason, but we don't really care why you're here, we're just glad you're here.
Just to kind of catch you up a little bit, everybody knows we're doing the downtown revitalization. Phase 1 is almost complete. That was done by Dyer County for Phase 1. Phase 2 will be bid 2 weeks from tomorrow. That will be the outside perimeter of downtown. Then there's a Phase 3 that will be bid sometime this fall, hopefully. That will be the downtown River Park area that we are also anticipating. So there's a lot going on in our community about walkability and sustainability and healthy living and things like that. And I'm just so glad this community has come together to support this.
When this event was held, the first event back in the fall, if you came, you probably remember a young man by the name of Andrew Carberry who spoke to us about photo voice. And we looked at that and said, you know what, if we're going to be a healthy community, why not involve some of the kids in our community? Because we've learned as photographers that you see things differently when you look through a lens of a camera. The middle schools were targeted, and in Dyersburg, Dyer County, we have 3. We have Northview, Three Oaks, and Dyersburg Middle. And we had kids in all 3 schools who volunteered to participate in our Photo Voice project. We purchased disposable cameras with 27 exposure, and we gave them to the kids and said, go out and see what you see about your community that's healthy. And also look for things that maybe are not so healthy, and take pictures. And so the pictures you see over on the corner over there are basically posters created digitally by a sample of the pictures for each kid, and we put those together and framed them, and we're going to use those around town.
In 1952, 60,000 people reported having polio, and there were 3,000 deaths that year from polio. Do you guys know by 1979 we had eliminated polio in the United States? In 1991 we had eliminated it in the entire Western Hemisphere. And you think about the work that we've done in tobacco. Today we have 27 states that are smoke-free, also the District of Columbia. So we have accomplished great things in public health. So when we stare this epidemic down, we should stare it down knowing that we can combat it, we can tackle it.
And they put them in one of 3 groups. Group number 1 got the standard counseling, like here's your pamphlet information, you're at risk for diabetes, and I'm going to put you on a pill. They started on prescription, take it every day. Second group got exactly the same counseling and information and education, and they got a pill too. What they didn't know was half of them were getting metformin, which is a diabetes drug, and half were getting a placebo. Now, interestingly enough, and to the great credit of the researchers, there was a third leg in the study, and they didn't get the standard counseling, nor did they get a pill. What they got was put in an intensive lifestyle modification program that included at least things like shopping and cooking classes, so they learned how to purchase and prepare healthier foods, and at least 30 minutes of physical activity 5 days a week on average, 150 minutes a week. My question to you, and again, not a rhetorical question, which group did best? 3. Well, it better be, or else why am I talking to you, right? Here's the interesting thing. The people who were in the drug treatment program saw almost a 30% reduction in risk of developing full-fledged type 2 diabetes compared to the people in the getting the placebo. Let me say it again. 30% reduction in risk. That is massive. That is unbelievable. That's like, in these kinds of studies, it's mind-blowing to get a 30% risk reduction with a treatment. The only reason it's not the big news is that the people in the intensive lifestyle program saw nearly a 60% reduction in risk, almost twice the reduction in risk by changing lifestyle. Let me make clear what news this is. They stop the study early because it's considered morally unethical to have a treatment that is that much more effective and not give it to everybody in the study. As long as we only talk about the obesity epidemic, everybody asks, when is the leptin-based drug going to be ready to treat obesity? When am I big enough for bariatric surgery? We're in treatment mode. I want us to start driving home the point that the real epidemic at the heart of this are epidemics of physical inactivity and poor nutrition. They're the drivers because here's what we know. Those two are independent risk factors. Even separate from any weight change, being more physically active helps you live a longer, healthier life. And let me be really clear about this. If you care about healthcare costs in this country, and you're part of the debate, and you're debating whether we need a single-payer system over here, or whether we need to deal with a market-based system over here, and you're screaming at each other across the aisle, shut up already, because none of that matters. The healthcare debate, none of that matters if we don't do something about primary prevention and actually making people healthier. And we will only do that if we reduce tobacco consumption, help people be more physically active, and help them eat a better diet all the time. Is anybody else with me on this?
I want to take all the notes, by the way, though. I don't want you guys to don't throw these papers out, because I know there was a lot more good thinking than I allowed you to give, so I want to see the rest of it as well.
The work that you've done here today, as you see things beginning to change in your community, just pat yourselves on the back, because it will be because you came, you showed up, and you engaged with us. You've done everything that we've asked you to do.